Nurse Angelica Contreras from BSN1-11C Group 10. Today I'm going to perform how to get vital sign. We're going to collect the patient's temperature, pulse rate, respiratory rate, and blood pressure. In addition, we are also going to ask the patient's pain level or pain rating, which is often referred to as the fifth vital sign, along with collecting the oxygen saturation. To start off, we need to prepare all the necessary equipment that we're going to use. So, we need a thermometer, portable oximeter, wristwatch with a second hand, stethoscope and sphygmomanometer, cotton, and alcohol. Before meeting the patient, we need to do a hand washing or hand hygiene to deter the spreading of microorganisms, and wear PPE if necessary. Always remember that before using the equipment is we need to disinfect it or clean it. So we're gonna use cotton and alcohol to disinfect the equipment. We also need to make sure that the equipment are working or is working. Okay. Now we are all set. Now we are going to introduce ourselves to the patient and explain what are we going to be doing. Hello, I am Angelica Contreras, your student nurse for today. And now I'm going to be taking your vital sign. Is that okay with you?
Yes.
Okay. Now that we are done introducing ourselves to the patient and explaining what are we going to be doing, we're going to identify the patient by checking their wristband or asking them their name and date of birth. Can I hold your hand to check your wristband? Okay, thank you. Can you please state your first and last name to me?
My first name is Ivy and my last name is Salah.
And your date of birth?
August 19, 2002.
Okay, thank you. And how would you like me to address you?
You can just call me V.
Okay. Now, I'm going to ask the patient's pain level or pain rating. It is important because this can affect the patient's blood pressure, pulse rate, and respiration, especially when they just undergo any surgeries or have some type of trauma. When assessing the patient's pain level, there are many types of pain scale, but I'm going to use the 0 to 10 numerical scale. V, can you rate the pain that you're feeling right now, as 0 being no pain at all and 10 as the worst pain you ever had?
0.
Okay. Always remember that all the data that will be collected should be documented. Now we're going to check the patient's oxygen saturation using the portable oximeter. We're going to turn on the device and place it on the finger of the patient. And let it get the reading. V, your oxygen saturation is 98%. After we are done using it, we need to clean it with a cotton and alcohol or disinfectant wipes. And place it back to the case. Next is I'm going to check the patient's temperature using an axillary thermometer. So we're gonna remove it from its case. The tip of the thermometer should be put in the armpit of the patient and not in the clothes. So, I'm gonna turn it on. Can you please put it in your armpit? Then we will wait until the thermometer beeps. Your temperature is 36.2 and it is normal. After we're done using it, we also need to clean the tip using the cotton and alcohol and place it back on the case. Now, we're gonna check the pulse of the patient. We're gonna count the rate and feel the intensity of the pulse and grade it on the scale of 0 to 4 plus. We are also going to check the rhythm if it is regular or irregular. In adults, the radial artery is the most common used site because it is easily accessible. So, we're gonna feel the pulse but not press it too hard. If it is regular, we're gonna count for 30 seconds and multiply it by 2. But if it is irregular, we're gonna count it for 1 full minute. Okay, so your pulse is 83 BPM and it is normal. We are just gonna place our finger here. What are we gonna do next is check the patient's respiration. And we are not going to tell her that we're gonna check her respiration because if we do so, she can change or alter the way of her breathing. It is best to look at the side of the patient and observe the rising and falling of her clothes or chest, or if the patient is wearing a gown. We can also touch gently the back of the patient and feel the rising and falling of her chest. 1 rise and 1 fall is equal to 1 respiration. If it is regular, we're gonna count for 30 seconds and multiply it by 2. And if it is irregular, we're gonna count for 1 full minute. Your respiratory rate is 12 BPM. Now we're going to check the patient's blood pressure. We need to make sure that the patient is sitting down and the arm is at heart level and it is at rest, and also the legs should be uncrossed. We also need to make sure that the cuff that we will be using is in the correct size. It should not be larger or smaller than the patient's arm. First, we're going to palpate the brachial artery because this artery is where we are going to listen to get the blood pressure of the patient. Is it okay?
Yes.
Okay. Now we're going to wear the earpiece and open it. We're going to place it where we found the brachial artery. We're gonna close the valve and squeeze the bulb until it reaches 180. Then we're going to slowly open the valve. The first beat is the systolic and the diastolic is where we can no longer hear the beat. Okay. Your blood pressure is 98/76. Can I ask if you're anemic?
Yes, I am.
Okay. After using the stethoscope, we need to clean the diaphragm using the cotton and alcohol. Or we can use disinfectant wipes. Then we need to return the cuff in the bag. Always remember, after doing assessment or having in contact with a patient or just taking her vital sign, we need to do a hand washing or hand hygiene. Done!